Hi, Varshini.
Hi, I think we're going to give it a little bit just to give people a chance to join. So we'll start at about 3:05. That's okay with
Sure.
everyone?
That sounds good.
All right. All right. Hello, everyone. My name is Varishni Diochand, and I am the director of XdHacks Mini Toronto, and I am so excited to have everyone at our networking event. We are featuring 3 panelists who are also here, Dr. Mamdani, Mr. Olariu, and Dr. Mandich, who will be giving presentations throughout the networking event. And we will also be having a raffle prize for a Panago Pizza compliment certificate at the end. So please stick around as we will be doing the draw at the end of the networking event. Okay. Let me just figure out how to switch slides here. Okay, so just a few housekeeping kinds of rules. We are going to be hosting our virtual hackathon on Friday, Friday, July 16th to Sunday, July 18th in 2021. So registration for that will be available in the coming months. So I encourage everyone here to form a team and keep updated on our Instagram page, which is listed right there, and email us if you have any questions or concerns at the email address listed there. You can also visit our website at that link down there. If you want to just take a screenshot of this page, that would be amazing. So at this point, I would like to call on Mr. Olariu to introduce yourself, and we shall be getting started shortly.
Hi, everyone. I'm Dumitru Olariu, intellectual property advisor with an organization called the Canadian Intellectual Property Office. That's the main organization dealing with intellectual property in Canada. My background includes electronic engineering and also business administration. I've worked for 5 years as a patent examiner with the same organization. Then I become an intellectual property advisor doing outreach events mainly. And I thank you very much for the opportunity to speak to you today. Thank you.
Okay, thank you, Mr. Olariu. Next, we can have Dr. Mamdani. Would you like to introduce yourself?
Hi, everyone. My name is Muhammaud Mamdani. I am Vice President of Data Science and Advanced Analytics at the Unity Health Toronto organization, which is a compilation of St. Michael's Hospital, St. Joseph's Hospital, and Providence Healthcare in Toronto. I'm also Director of the Temerty Center for Artificial Intelligence Research and Education in Medicine at the University of Toronto. I'm a professor at the University of Toronto in the Faculty of Medicine, the Leslie Dan Faculty of Pharmacy, and the Dalla Faculty of Public Health. And my background is I have clinical training. I'm a clinical pharmacist by training. I also have graduate degrees in economics of all things, in econometric theory, and in statistics and epidemiology. And my current job is I head up a team of data scientists at our hospitals, and we create AI solutions and we bridge it right into medical practice. So I'm really looking forward to talking about it.
Amazing, thank you. And finally, Dr. Mandich, please introduce yourself.
Hi, everybody. I'm so happy to be spending this time together on a Saturday. I am a happiness researcher. So all of my work looks at the science of happiness. So I went to school at Western. I'm from London. I don't know if anyone here is from there. And now I live in Toronto. I do research part-time at Sick Kids here in Toronto. I do a lot of private practice, a lot of private consulting and things like that, where we incorporate different technologies and looking at how do we measure happiness and all of that. I'm also the happiness expert on basically every TV show here in Toronto: Social, Breakfast Television, Marilyn Dennis, Morning Show. So I like to take research and make it accessible in a lot of different ways. So I'm very happy to be here with all of you today.
Amazing. Thank you, panelists, for your introductions, and we will get started now. So, Mr. Olariu, I'm going to make you the host, and you can proceed to share your screen. Okay, you should be the host now. I believe you're muted.
Hello. Hello, everyone. So that's a presentation that I will use today. It's our generic presentation or the basic presentation on intellectual property. It's called Bring Your Creations to Life, Why Intellectual Property is so important, why it matters. So what we will do during the presentation, we will talk first briefly about the organization that deals with most types of intellectual property in Canada, Canadian Intellectual Property Office, CIPO in short. Then we will dive into why intellectual property matters, then review the main types of intellectual property in Canada and give you very useful tips on how to use established intellectual property rights. And then, because that's what it makes sense when you deal with intellectual property to make money out of it, is to have some sort of intellectual property strategy that will match your business strategy, will be in sync with the business strategy. So you'll be able to see how intellectual property will help your business grow. And we'll end the presentation with intellectual property resources. So Canadian Intellectual Property Office is an agency, a federal government agency of a ministry called Innovation, Science and Economic Development. It's known as the main administrator of intellectual property rights in Canada. And most countries have a similar like organization dealing with intellectual property. It's probably important to know at this stage that Canadian Intellectual Property Office, it's like a tier 2 in terms of size as an intellectual property office. The main intellectual property offices in the world are United States, European Intellectual Property Office, Japanese Intellectual Property Office, and the Chinese Intellectual Property Office. So we are the tier 2 organization. However, we have a very good reputation on a very good quality work. So our job is to issue intellectual property rights that have a so-called strong presumption of validity. What it means is to be useful legal instruments for whoever owns intellectual property rights to enforce the intellectual property. CIPO is also providing a so-called passive judicial function for trademarks and patents, but it means that there is a board where people can oppose the trademark registration or a board that re-examine patents. What is not so known, however, very important, is that we have a mandate to raise awareness for the effective use of the intellectual property system in Canada. And we do that because we know that you'll better take advantage of the intellectual property system and intellectual property assets in general if you'll be aware of how the system works. It's a highly specialized system somehow. You'll be better equipped to make informed decisions, so you'll not spend money and getting frustrated because you didn't get what you wanted for the money you spent for intellectual property rights. And this will translate in increasingly using effectively intellectual property system. So why all this? Because people, business people, using wisely intellectual property system, they perform better. Businesses experience growth when they take good care of the intellectual property. They are likely more to export, going in different markets. And they also much easier get financing. So investors look carefully on your intellectual property assets. Also, CIPO shared information that is provided in its intellectual property databases, and in that way support innovation. And lastly, and not the least, CIPO is representing Canada in defense on international fora, Canada's intellectual property interests. But what is intellectual property? Intellectual property starts with an idea. However, it's considered the creation of the mind. You will not be able to protect the idea without implementing that idea in creation. So the creations might be inventions, artistic works, design, logos, and much more. We'll go in further detail when we'll talk about different types of intellectual property. So intellectual property right is the right that the creator has vis-a-vis the work they created. And this right is quite powerful. It's like a monopoly in some instances, and it's very valuable. So the title or the ownership of intellectual property starts with the owner. However, with the creator, sorry. However, the owner might change in the sense that the creator works full-time for a company, then the ownership of intellectual property created by that particular employee belongs to the company. Intellectual property rights makes your offering unique in the sense that people trust creations that are covered by some sort of protection as intellectual property. I would like to make two quick comments here about intellectual property misconception. So once I said that the idea is not possible to protect by any form of intellectual property, so the implementation of an idea. Then intellectual property right, the right to how you use this creation is not a self-enforcing right. You have as an intellectual property owner like an obligation to see, to monitor if your intellectual property right is respected. So why should you care about intellectual property? It gives you first an edge over the competition. You have that competitive advantage others don't have. And your competitors cannot go and use your creation without your approval for a period of time. You also help build reputation and goodwill in front of your partners, clients, and especially investors, actually. So you can use intellectual property rights to attract investors. And when you put all these intellectual property assets, rights, in sync with your business strategy, you may achieve much easier your business goals. You also may secure your markets because you have that kind of monopoly that I mentioned before. When you try to establish intellectual property right, you actually, in many situations, you file an intellectual property application, give some information about yourself, about what you created, and all this information is stored in so-called intellectual property databases that are managed in Canada by Canadian Intellectual Property Office. So what information you can extract from these databases? First, you'll see what others have as intellectual property rights, so you'll be able not to infringe on someone else's intellectual property rights. But you will also be able, by doing an intellectual property search, to see what your competitors are doing. So you'll have a very good intelligence. You'll be aware of what they are doing, and you'll be able to adjust your business strategy based on that as well. So bottom line, you'll be more focused, you'll strengthen your business strategy. Okay, so we will talk more about different or main types of intellectual property in Canada, and they are trademarks, patents, trade secrets, copyrights, industrial designs. I would like to mention that you also have other forms of intellectual property this presentation will not deal with, like plant breeders' rights or integrated circuit topographies or personality rights. They are somehow more specialized intellectual property rights. So, but main types of intellectual property types are those that are mentioned in this slide, and we'll go step by step, giving you tips and more details in the coming slides. So let's start with the trademarks. In this situation, the creation of the mind that I mentioned in the general definition of intellectual property are brands. So brands are associated with a form of intellectual property that is called trademarks. And what are they? They are actually identifiers of products and services of different companies. So this kind of identifiers might be letters, might be words, might be symbols, designs, might be even moving images, sounds, modes of packaging, maybe holograms. So all this, if they identify and point to the producer, identify different products and services and point to whoever is behind these products and services, who supplies them, then you'll have a trademark. So once you establish the trademark rights, you have the right to use that kind of identifier exclusively for those products and services. So you have the right to stop the others from using the same kind of identifier. In Canada, there is a mix of use and registration. What this means is that you have, by the fact that you are using consistently for a period of time in a certain area of Canada, you have so-called trademarks common law rights. So what this means is you'll be able to, for the time you are using it in that particular region, you'll be able to stop others of using the same kind of trademark. And for similar like products and services. The registration is advisable though, and the registration will give you the two main things. You'll be able to get an additional evidence of ownership of your trademark, and you'll be able also to much easier enforce your trademark rights. The registration lasts for 10 years, and it's renewable every 10 years. Most of the intellectual property types are limited in time, and after that they become public domain. However, a trademark is an exception, because if you use it consistently as such, and you register it and renew it, you'll have like almost indefinite protection. It's advisable to use the trademark and mark it properly. If it's not registered, you mark it with a TM. If it's registered with an RN circle. So let me give you several tips concerning trademarks. When you choose a trademark, a word trademark, it's better to see how powerful this kind of identifier would be, and if it will be distinctive. So this slide shows you what are considered the most valuable trademarks, coin terms, Kodak, Kleenex, Polaroid, for example. Dictionary words not related to the character or quality of the goods and services, they come second. Suggestive marks are somehow weaker. However, using them consistently, people, consumers, people buying products and services with this kind of suggestive marks, they associate quickly with a certain quality of the product or service, and they work as a trademark because they point to the actual producer. Personal names are not recommended, but there are exceptions as well, as probably one of the famous is Tim Hortons. So anyone knows that if they go to a Tim Hortons coffee shop, what kind of products and services they expect. Descriptive marks are not recommended. They are considered weak marks. They are hard to register. There are exceptions as well here. One famous exception is American Airlines. They describe exactly what the services are. However, with a proper marketing, they were able to get this distinctive character that they have. When you say American Airlines, you'll not confuse that kind of airlines with Delta or other American airline. So that would be for the trademarks. Now let's talk about patents. In this situation, the creation of the mind is a creation that belongs usually to the technological scientific field. And it's a product, a process, a machine, a composition. As a product might be a door lock, a machine that produces door locks. Lubricant for door locks might be a composition of metal. The process used by the machine that manufacture door locks might be patented. So all these are subject matter that belongs to technological scientific field, but they have to be new in the world to be useful, to have some sort of utility, and also be non-obvious or show a scintilla of invention. In order to obtain a patent right, you have to apply for it and process a patent application and give a full description of the invention. Otherwise, you'll not get the patent right. And you'll also have to claim properly whatever is what you invented, what is new compared to the existing field of technology. And once the patent is granted to you, you have the right, a very powerful right, monopoly, that allows you to exclude others from using, making, or selling what you claim as your invention in your patent document. So there is an application process and grant. Application usually lasts 2 to 3 years. The patent rights is up to 20 years from the filing date, so you may count at protection of roughly 17 years. The invention has to be new when you apply for the patent. In Canada, in the United States, you have 12 months grace period. It's not advisable to be used. Several patent tips. It's better not to reinvent the wheel, so not to start from scratch. So you do a preliminary prior art search online. You may use the keywords. However, the most professional patent search is one that uses the patent classification. So you'll be able to get a more accurate result and not search too many records. It's advisable to hire a registered patent agent or lawyer. They are trained and they are able to draft, write, and process your patent application. The danger of not having an agent, if you don't take enough time and effort to do a good job yourself, then you may disclose something that you are not claim. So this is like a giving away. So the agents and lawyers are specialized in domain and they are able to get the proper patent right for you. Most of the patents are actually for improvements to existing products. Keep in mind that you may improve on already patented product, so you get the right for the improvement, get that patent right for the improvement, but not for the previous product. So the right that you get is like a veto power. That's what this slide tries to convey. So you'll still get a patent for the improvement, but in order to work your improvement, you probably need permission from the owner of the initial patent in order to work your invention. Again, it's advisable not to disclose, and you have 1 year window of opportunity. Keep in mind that trademarks, patents, and other forms of intellectual property are territorial. Other jurisdictions don't have this kind of 1 year window, so it's not advisable to use it. So let's go on with the trade secrets. Trade secrets are actually any kind of confidential information that gives you a competitive advantage, maybe product related, like what I mentioned before, a product, a process, a machine, a composition, might be trade related, like business plans, list of potential clients, list of suppliers. All this might give you a competitive advantage. In order to take advantage of this kind of intellectual property right, you have to keep the information confidential, to take some steps, and we'll give you some tips in the next slide. No registration, no formal rights, just a contractual obligation. That's what it means. The protection lasts as long as confidentiality is maintained. And once the confidentiality is lost, then the protection is lost too. So keep in mind that you have that possibility because of the contractual obligation as a trade secret owner. You have the possibility to go after the people who wrongfully disclose the trade secret. However, in most cases, the value lost, the trade secret value lost is much higher than you can recuperate by claiming some sort of compensation from those people who wrongfully disclose the trade secret. And most of the research and development work, actually, it's covered by the trade secret. People take that kind of protection seriously, and they decide to keep it confidential before patenting. Patenting is expensive. It's risky in some situations. So people take good care to keep secret before making that major decision if it's worth patenting or not. Several trade secret tips. So as mentioned, you use non-disclosure agreement, NDA, or confidentiality agreements. There are confidentiality clauses in employment agreements. Here you may conduct, if you are a business owner, you may conduct exit interviews with the employees who are exposed to the trade secret of the company. Encryption is used, password protection, lock and key, and you'll try to limit the number of people who access the trade secrets. It's a very popular, actually, and the only form of protection that you have in the very beginning before patenting. So in some situations works fine, in the sense that you have a process that you can use internally. So you'll probably not be interested in disclosing the process that you are using. You just take good care of keeping it confidential, because if you want to obtain a patent for the process, you'll have to describe it fully. Plus, once the patent is granted to you, you have to have some sort of monitoring system in place in order to police your patent rights in this case. Okay, next would be copyright. Here, the creation of the mind is, there are creations that belong to the cultural field, literary, dramatic, musical, artistic works. For example, architectural work are considered artistic works, so they are covered by copyright. You have not only the right to copy, but once you acquire this right, you have a bundle of exclusive rights to publish, reproduce, perform, translate that work in some situations. This right is automatically acquired at the moment when you finish creating that work. So no need to register. However, it's advisable to register. What's considered a good tip is to market properly. And I will talk more about other tips as well. In general, the duration is for the life of the author plus 50 years. And because Canada signed most copyright convention, it's considered an international form of protection. So it's not territorial like the others I mentioned. Several copyright tips. If you want to register, you can do it easily online on our website. It's important to mark it properly. That's how you acknowledge that you own the copyright. It's a good practice as well that you give some information about how people may obtain permission to use your work. It works better than saying that you'll enforce copyright if you find someone infringing in your work. Keep in mind, like other forms of intellectual property, that you'll not be able to protect the ideas. You'll protect just the implementation of an idea. In many situations, the first author of the work is not necessarily the copyright owner. If there is an obligation of creating that kind of work under the employment. Software source code is considered literary work, and it's covered by Canadian copyright law. However, you have the so-called software inventions, and they may be covered by, under certain conditions, by patents as well. A lot of money are being made through the licensing of the copyright. So let's dive now into another form of intellectual property, industrial design. Industrial design as a creation of the mind deals with the visual aspect of a manufactured article. So it's the original shape, configuration, pattern, ornament applied to a mass-produced article. Almost like patents, you have an obligation in order to establish that right to file an industrial design application and get the registration of your industrial design. Once you get the registration, you have the right to exclude others of almost like patents, making, using, selling, or exhibiting for sale that particular design for a limited period of time. And that's up to 15 years from the filing date. You also have a 12 months grace period. Like for patents I mentioned there, it's not advisable to be used. This slide shows a Coca-Cola bottle. You may consider that Coca-Cola bottle in the very beginning covered by copyright. However, because it's mass-produced, copyright ends after that, and industrial design would be a form of protection that you'll have for this Coca-Cola bottle design. However, if you use that kind of design like a sign to identify the non-alcoholic beverage inside, works as a trademark. So you have three forms of intellectual property just in one product. Next slide, about tips on industrial design. You do a preliminary search online using our industrial design database. Keep in mind that your design has to be new. You cannot claim functional features or composition structure in a design. You just protect the visual aspect of a product. I mentioned that you might use the a distinguishing guise or the wrapping or the container of a certain article. You can use it as a trademark, and you had in the previous slide the Coca-Cola bottle. It's not too complicated to do it yourself. However, you may hire registered patent agents or lawyers who could take care of your industrial design application. You may submit 6 pictures of the design showing the original features of the design and pay the fee, and it is processed by us, by our industrial design examiners. Okay, so these are the main types of intellectual property that you find in Canada. And everything starts with the creation of the mind, as I mentioned, but depending on what creation you have like an interactions of different intellectual property types. If you have an invention, as I mentioned, first it's considered covered by trade secrets, then by patents, if you're interested in obtaining a patent. The design I mentioned previously, you have industrial designs, you have trademarks, and even copyright for in certain situations. Brand name logos might be covered by copyright logos, for example, because they are considered artistic works. Industrial design as well. Trademarks, if they identify products and services and they point to the producer or the supplier of those services, work as a trademark. Copyright trademarks are related with the most visual, literary, musical creations. And it makes sense for a company to look carefully at what they have, what they created, and how they use it. So it makes sense for them to do a so-called intellectual property audit and see what kind of intellectual property assets they have, because they may use it to achieve their business goals. And that's like an introduction to the next topic, that is intellectual property strategy. What it means, or the definition given by Mars, is that IP strategy is a series of decisions and methods designed to maximize the contribution of intellectual property rights or assets in achieving the business goals. So that would be like a general definition. There are different types of intellectual property strategy, and we'll give you several examples. You usually start in developing an IP strategy by doing that intellectual property audit that I mentioned to you. So you see what you have and what you would like to have in order to do or to have a intellectual property portfolio that will help you in achieving your business goals. And when you do this kind of auditing or administrative task, it's very good to put a money value on the different intellectual property types that you own, and align business strategy and goals with those intellectual property assets. And you'll put a higher value if they will help you achieve much better your business strategy. Lower value sometimes when they are not so much in sync with your business strategy, or simply decide that it's better to sell them. So that's how you'll exploit intellectual property. You may license whatever you consider suitable for your business strategy to allow others to use your intellectual property. You may commercialize intellectual property that way. It's important because it's not a self-enforcing rights, intellectual property, as I mentioned before. So it's important to monitor internal use. That means that you're not infringing someone else's intellectual property rights. Your employees know how to deal with different forms of intellectual property. They take care as well when they develop a new product to keep it secret and then seek different kind of protections, as I mentioned, patents. It's also important to monitor what others are doing, if they are infringing on your intellectual property rights, and take steps to enforce your intellectual property rights to prevent and remedy infringement. That's quite important. Okay, an example of different IP strategies. So again, it depends on each company and what kind of intellectual property assets they have, in what field of activity they perform. That counts a lot. In what countries they operate, that's important too. But here on this slide, we have different types of intellectual property strategies. One would be just to protect key technical aspects of a product, so you seek patent protection, and you'll try to get protection for whatever the market needs. It's a small improvement. However, it is patented, and you will be able to shut your competitors out to use this kind of valuable improvement required by the market. You may simply place on and focus on the brand value of your products and the services. So you'll not go through the patenting route that is quite expensive in many situations. So you'll focus on the trademark kind of protection of your assets. You may file aggressively and try to enforce intellectual property rights against your competitors. You may also file because you would like to have that peace of mind in order to manufacture or use a process. So you'll patent just for defensive purposes. You may use a combination of all these types of intellectual property strategies mentioned above. You may also decide not to file for intellectual property protection because it doesn't make sense for your business. So you may base your strategy on other forms of activity. So you'll not be interested in filing for IP protection. In many situations, people who consider too costly to patent something because they are not sure how successful their patent would be, they decide not to file it, just disclose what they invented, and in that situation they stop others of obtaining a patent. Okay, so this presentation ends with valuable intellectual property resources that you may find. I suggest that you start with our business website. It's called IP for Business. It's a part of our of the general SIPO website, and here you find different tools that will enable you to understand different types of intellectual property, and going from very simple to complex. You have case studies. You'll be able to use intellectual property system in a better way when you'll use this kind of resources. You may also enroll for our seminars and presentations. We have this generic presentation, but we also have more specialized e-learning modules, and I advise you to go on our website and see something that will be of interest to you. Here you have our contact information. We have our client service center. You may also get answers to your questions. You may also contact one of us, like myself, intellectual property advisor. We are 4 people across the country. However, we are ready to explain you how to use different intellectual property assets and to set up a so-called intellectual property strategy. So that would be the end of the presentation, and I wonder if you have any questions.
Okay, thank you for your presentation, Mr. Olariu. I do have a question, actually. So in this day and age, there's a lot of small startup businesses and inventions and things like that. So I wanted to ask, when do you think is the right time to file for intellectual property or to get a patent per se?
We cover that because a lot of people are asking the same kind of question. We cover that in our guide to patents. The ideal time to file for a patent would be after you work a prototype. So you have an idea how to describe your invention, what are the setbacks of your invention. You'll be able to come with a decent description of your invention. That's why you'll get the patent right, and you'll be able to claim properly. And from that time, when you work a prototype, until you'll put that prototype in a mass production, then probably 2 years, it will be enough time for you to go through all these steps. And so the patent right will be granted after 2 years after you file the patent application.
Amazing. Thank you for that. Anyone else have any questions? Alrighty. So thank you, Mr. Olariu, for that very informative presentation. I can say that we all learned so much. And now we will go on to, I believe it's Dr. Mamdani.
Great. Hi, everyone. I'm going to share some slides, if that's okay.
Yep.
Great. I think it's still disabled, so I think I may still need access.
Okay. Yeah. I just thought that everyone was able to share the screen, but I will make you the host now.
Great.
Okay. Yep, you should be the host.
Fantastic. Thank you. Okay, so you can see the slides.
Yep, we can.
Fantastic, because what would a presentation be without slides, right? I'm going to try and go through kind of what I do for a living, I guess, these days, going from compute to care. And the whole kind of notion here is artificial intelligence medicine. And my background is a little bit weird. I've combined a whole different number of disciplines. And I guess you can say, like, when I think back about when I was in high school, I really liked math. Math was like a big thing for me. And I remember growing up in a very typical South Asian family, and I'm sure the culture's the same in many other groups, the East Asians as well. You know, you have 3 career options that your parents tell you. You're either a doctor, engineer, or you're a disgrace of the family. It's pick one of the 3. And so we struggled a bit around, all right, well, what do I do? What are my expectations? I got to make my parents happy. I do kind of like science, and I like the whole healthcare thing. So I kind of chose the path of least resistance. So I actually went and did a degree in clinical pharmacy. So I went to the University of Michigan in Ann Arbor because Canada didn't have that degree at the time. And now we do. It's I got something called a PharmD, a doctor of pharmacy, which is basically you do clinical work. You see patients and you do all that sort of fun stuff focused on medications. But then I actually said, all right, done my PharmD, I've spent a year seeing patients and doing clinical work. I want to do something a bit different. And I did a fellowship in pharmacoeconomics and outcomes research at the Detroit Medical Center because I had an interest a bit in the emerge and trauma. And at the time, there weren't a lot of people who knew much about economics. So I was actually doing clinical work most of the time. I was literally up on the floor seeing patients. And so I went to my supervisor and I said, well, when am I going to do economics? And he said, okay, we'll pay for a degree if you want it. So fine. At night, I took classes and got a master's degree in economics, focused on econometric theory. That's basically writing mathematical proofs for about 2 years, which it wasn't the most exciting thing, but it kind of brought me back to what I really enjoyed was math. And then I said, okay, that's great, but now what? I want to be able to translate some of the statistical concepts I'm learning into medicine, and economics doesn't do it. I'm going to go to Harvard and do a statistics and epidemiology degree. So I went to Harvard and did a master's of public health in statistics and epidemiology. Was broke at that time and I had to make some money. So I got a job, came to Toronto, and worked at several places. And was really kind of a typical researcher type. I did a lot of research, and I actually did clinical work as well. So I saw patients for several years after I came back to Canada, and published, I think I've got over 500 publications or so. But after a while, you say, well, you know what, does it really excite me that I'm getting publications and doing the research stuff? Not really. So I kind of stepped back a little bit, and I thought, what really is exciting? And when you think about healthcare, I was really fascinated by the miracle of modern medicine. Yeah, I mean, in lots of cases, I mean, let's face it, we can make people who lose their vision, in some cases, restore their vision, give them sight back. In other cases, people who would never have had a chance before and were involved in major accidents should not be able to walk or run with their kids. We're able to enable them to walk and run with their kids. People who historically would have been dead because they had cancer, some of them were able to make survive. It's incredible what we're able to do in healthcare and medicine these days. Now, of course, I'm going to go to the other side, the dark side of healthcare and medicine. It's complicated. It's really, really complicated because we have this human body. And does anybody know what human body is made of? In essence, we're all made of cells, right? What does a cell look like? There's lots of pieces to a cell. There's mitochondria, a nucleolus, ribosome, cytoplasm. There's a whole bunch of components to a cell. And you can imagine there's thousands of processes that are going on in each of these cells. And if you had to kind of look and really dissect it further, there are 100 trillion atoms in a human cell. And as humans, we have about 100 trillion. It's actually closer to 70 or 80 trillion cells by latest best guesses. That's a lot of cells, and that's a lot of atoms. All it takes is one thing to go wrong, and you have disease. So it's incredibly complicated. It's very involved. And it's been quoted as saying, medicine is a science of uncertainty and an art of probability, by William Osler, who was a very famous physician. What we know of right now is that there are probably over 10,000 diseases. And we as humans, and trying to understand this complexity, we know there's way more than 10,000 diseases, but we've only been able to identify about 10,000 or so. Now, the interesting part is, how well do we understand these diseases? Because if we understood everything, we'd be able to cure them. The reality is that only about 500 of these diseases have US FDA approved treatments, only 500. So there's a lot that we don't know. And the vast majority of these treatments don't really work that well, to be honest. I'll even take it one step further. How many of you have used Tylenol or acetaminophen? I imagine a lot of you have used Tylenol, right? So what if I told you, we don't even know how it works? We really don't know how Tylenol works in the body to be able to reduce fever and, in some cases, pain. It's been around since I think the first PrEP was formulated in the late 1800s and commercialized as Tylenol in 1950, if I'm not mistaken. We still don't know exactly how it works. So there's an incredible amount of uncertainty in medicine. And for all the miracles that we've been able to drive through modern medicine, there's much, much more that we simply don't know. And I got to say that the key thing here is medicine is knowledge driven. It's all about information and data in medicine. There's a new healthcare study that's published every 2 minutes. If you look at Medline, which is this huge repository of all the medical studies that have been done, I shouldn't say all, quite a few of them, there's over 30 million studies in that database. About 1 million new studies are published each year, and that keeps growing every year. We can't keep up with all this information as clinicians. There's no way. We'd have to read literally a study every 2 minutes. Some studies don't even agree with each other. So how many times have you heard, oh, this study says this thing is good, and then another study comes out and says, no, it's really not very good. That happens all the time. What do we believe? What's true? Sometimes your guess is as good as ours. New therapies are emerging, or they're just coming up constantly. There's drugs, there's medications, there's gene therapies these days. There's all sorts of new therapies that are coming out. And expert opinions, when we look to the experts saying, look, there's way too much. You're a specialist in X. Can you tell me what's happening? Even their opinions change over time. So what do? The reality is, because there's so much information out there, and if you think about it, how does your doctor manage a condition? Well, they're going to have to assemble all sorts of data and information and say, yes, you have this condition. And yes, this treatment may work, but it's not going to be perfect. The reality is 1 out of 3 patients do not get treatments of proven effectiveness. 1 out of 4 patients get care that is just not even needed or even potentially harmful. That's 25%. Up to 3 out of 4 patients, so the majority of patients, don't get the information they need for decision-making. And up to half of physicians don't get the evidence they need for decision-making. So this may alarm you, and you may say, okay, I'm never going to go see a doctor again, or never going to a hospital again. And in some cases, you shouldn't be going to a hospital. But I've got to say, there is a lot of uncertainty, and yet we still are able to treat so much and do so much for patients. But there's so much more that we could do. So how can data and AI help? So the issue is underlying disease and prognosis. We don't even understand the majority of diseases that are out there or the treatments. And I'm just being very frank. The tools that are available. If you really think about it, how do we diagnose disease? Well, we listen to your heart, do the stethoscope. We take urine samples and look at your poop as well and fecal samples. We do lab tests. We look at your blood. They're not incredibly sophisticated, to be honest. And yeah, one would argue that, yes, it's pretty incredible that we are able to look at all sorts of deformities and such, but it's still not that sophisticated compared to all the complexities of the 100 trillion cells and 100 trillion atoms in each of the cells. We're nowhere near getting at it properly. There's also human capacity. One of the biggest challenges is, as humans, how many things can we process at the same time? Again, remember, 100 trillion cells, 100 trillion atoms in each of the cells. Anyone want to take a guess in terms of Miller conducted an experiment that tried to assess what's the rough number of things that an average human mind can process at the same time? Does anybody know? It's about 7. 7 plus or minus 2 things. Once we start thinking about 7 things roughly or more, we start falling apart as human beings. Health is way more complicated than 7 things at the same time. And medical care is driven by data. So we're constantly processing a ridiculous amount of data points, trying to make a diagnosis, trying to make a decision around treatment. It's not easy. That's where I think AI can come in. It gives us the ability to process virtually unlimited data points in virtually unlimited ways. And that's what excites me. We can use data, computers, and math to really figure out how we can actually diagnose diseases better, how we can make treatments better. Machine learning thrives on complexity because we know that this variable isn't directly related to this variable, but this one might be, and all sorts of stuff could go wrong in the body, and that's how we actually understand disease. The challenge of AI, though, is that we may not have all the data that we would really need. So we take what we have and we try and model it. And if the model doesn't have all the data we need, it won't really do that well, but we won't know until we try. Trust versus over-reliance. I can tell you in our experience with some of our stuff that we're doing in AI, sometimes there's so much trust in the tool that you stop being a doctor, and that's probably not a good thing either. And there's lots of limitations with AI. If the way machine learning models work, as many of you may know, it learns on what data it has. And if you're constantly feeding it biased data, so for example, a classic example is this initiative in the US where they had algorithms that would detect which patients would need more medical care, and they would actually direct those the resources there. And it was biased against Black people. The machine learning model will learn that bias, and that could be really harmful. And of course, there's the human AI bridge. If you go to the average doctor and say, I built this neural network and it had like 20 hidden layers, and they'll look at you with glazed look in their eyes. They'll have no idea what you're talking about. So how do you actually create a tool that clinicians can use effectively and efficiently for their patients without having to understand all the mechanics that they just aren't trained to do? So those are some of the challenges we have. So how do you design how do you bring AI to healthcare? So I'll tell you at our hospital, at my hospital, and at the University of Toronto as well, at the program I lead, we're thinking in these ways. But at the hospital that I'm based at St. Michael's Hospital. And so what we've done is we basically created a whole architecture around artificial intelligence. So our hospital has billions, if not trillions, of data points readily available on all the patients that we see, hundreds of thousands of patients worth of data. So we've actually created an environment which leverages that data. We brought in all sorts of horsepower like deep learning servers to process that data really quickly. We brought in tools like Python and R and Garobi and PyTorch and all these tools that data scientists want to have. And we've hired data scientists. So we've actually hired computer science people and statistics people and operations research engineering people, and they're all working together like mad scientists. But we did something that's a little bit different. Our research team with data scientists are not allowed to ask questions, because I wouldn't expect a computer scientist to say, well, you know, that cardiothoracic surgery procedure that Dr. X was, he would probably may want to make a different entry point. You don't have the expertise to say that, but the cardiothoracic surgeons do. The questions really should come from them because they understand healthcare a little bit better than our computer scientists do. Just as I wouldn't ask Dr. So-and-so to develop a neural net because Dr. So-and-so will have no idea what to do, but the computer scientist will. So that's where we actually said, you know, let's actually go right into the hospital. Let's actually ask our doctors, our nurses, our physiotherapists, our pharmacists, our administrators, what are your problems? What do you struggle with? And how would you fix them? And let's bridge you with our data scientists. So we actually have created an applied artificial intelligence living lab that brings together our doctors, our nurses, our clinicians, and our data scientists to co-create solutions. Now that sounds wonderful. All right, let's see some real stuff. Okay, so here's a real case. This is an actual patient that we saw at our hospital. So this is not made up, it's a real thing. There's a 73-year-old retired nurse with an inflamed gallbladder. So the condition is called cholecystitis. And she was parked in the internal medicine unit, and that's where we typically see these sorts of patients. She had a diagnostic procedure done, something called an ERCP, or an endoscopic retrograde cholangiopancreatography. Basically, it's this little wire in this camera that go in to look at what's happening in your pancreas. And we thought, you know what, it's pretty straightforward. We'll plan for the discharge next day. Unfortunately, a physician was called at 6:30 p.m. The patient had shortness of breath, and the physician said, all right, we got to order a chest x-ray and do some blood work. So we ordered some labs. The vital signs were checked twice overnight at midnight and at 6 a.m. The physician was then called at 8:30 a.m. because there was decreased blood pressure, distress, and the patient was transferred to something called the step-up unit, where she'd be monitored a bit more carefully and provide urgent care if necessary. And the critical care response team was called. Now, the patient did not want to go to the ICU, and she died in step-up that day. Of course, the family was understandably distraught at the sudden deterioration. We would never have left her bedside. She was suffering. And that was really unfortunate. The unfortunate part for this is we didn't know that this patient was going to crash and die. The reality is that 1 in 12 internal medicine patients will die in the hospital. So what can be done? Well, if we had to go back, we could have increased monitoring. So we could have looked at her a bit more carefully, a bit more closely. Maybe we could have thought about antibiotics because this could have been an infection. Called the critical care response team earlier, just to kind of have them on standby and make sure she doesn't crash. Palliative care, if we knew that she was going to die, at least we would have engaged the family. We would have actually comforted her a lot more, given her medications, eased that step into death. And of course, communicate. We'd be able to get the right people at the right time so the patient dies a dignified death with family, with comfort, or get the right people to save her life. So where could we intervene? We could have done all these things much earlier. We could have intervened before the patient suffered shortness of breath and started exhibiting symptoms, but we didn't because we didn't know. So can we predict who will die so we can intervene earlier? And so this is where AI comes in. So actually at St. Michael's Hospital, our team has developed an artificial intelligence algorithm, and this has been working now for about 7 months. So 7 months ago, we launched this. All of our internal medicine patients at St. Michael's Hospital are being monitored by artificial intelligence. So the way this works is that every hour we have an AI algorithm that grabs data, over 100 variables on all of our internal medicine patients. And every hour it says, is this patient going to die at least 24 hours from now? And it categorizes patients as low, medium, and high risk. As soon as the algorithm says this is a high risk patient, It pages the chief resident and the charge nurse to go see the patient right away because we need to do something. And we have care pathways. So in some care pathways, you need to increase monitoring every 4 hours. In other care pathways, you need to look for signs of sepsis, initiate antibiotics. In other care pathways, there are other things that we do. But the AI system triggers that alert. So this has been running for 7 months. Again, every patient at St. Michael's Hospital is being monitored by AI every single hour of every single day. It does not sleep. It's constantly working. Well, what's been the impact? In 2020, COVID has hit us really hard. And if we look at January to March of 2020 and compare it to the past 4 years of January to March, from 2016 to 2019, we saw an increase in mortality of 35%. In April to June, an increase in mortality. And this is among our high-risk patients. These are where we see the high-risk deaths. We saw an increase of 70%. In July to September, we saw an increase of 37%. It's at that point where we said, enough, there's too much of this going on. Let's test our algorithm and let's just deploy it. So fortunately, we deployed the algorithm in late August, early September of 2020, and we saw a 21% reduction in mortality. So we're really happy to note that AI is actually working and saving lives. And that's exactly the impact we want to see. Just as an example of what we're hearing, one of our physicians had told us, the resident on call overnight received a high-risk alert around 11 p.m. She went and reviewed the chart and saw the patient as per the recommended protocol. He was relatively stable. But approximately 2 hours later, she received a call from the nurse that the patient was decompensating. As she already knew the patient, she was able to quickly assess at bedside and get the ICU team involved. The patient went to the ICU, but did not, thankfully, have a respiratory arrest, which was certainly a risk if the intervention had not been done as quickly. The resident feels that the AI program had made a big impact. And these are the sorts of cases that we see. Just a few other examples. Within the first few weeks of us deploying this thing, there were 3 patients that were alerted by the system where the physician said, why is this thing alerting us? And when they did further investigation, all 3 of them had a massive infection behind the chest wall that likely would have been missed had we not had AI come in. And AI has been able to grab all sorts of different data. And literally, it goes through at least 500 to 800 different permutations and combinations of data every hour for every patient and see things that we may miss as clinicians. I'll give you one more example, and that's around brain bleeds. So one of the issues that we have is that at St. Michael's Hospital alone, there were about 600 people that came in with brain bleeds just in 2019 alone. So we see lots of people with brain bleeds. Here's the problem. The problem is a person comes in with a brain bleed, you suspect it because they had a concussion or they had some trauma to their head, and you send them to get a head CT. So a head CT is a computed tomography. Basically, it's an image of your head. Now, the image of the head then goes to the radiologist. Now, the radiologist doesn't really know it's a brain bleed until they look at it, but it's kind of parked here somewhere on their list, and they got a whole bunch of other patients they need to look at. So when they get to it, they realize, oh my gosh, this patient has a bleed. And that's usually over 3 hours from when they receive the images. That's somebody sitting in the emergency department with a bleed in their brain for over 3 hours. That's not good. We know from the literature that within the first few 15, 20 minutes, you start seeing really, really bad degradation to the brain within that amount of time. So could you imagine what 3 hours would do in many cases? So what we've done is we've created a platform, and this has been up and running for about 3 or 4 months now, where as soon as somebody comes in with a problem with their head and they get a head CT in the emergency department, it runs through an artificial intelligence algorithm. And the algorithm within minutes will say, yes, there's a bleed, here's a subtype, and here's where it's located by circling it on the scan. It then says, all right, I'm going to color code this person in purple and tell the radiologist, don't look at them now. I'm going to move them right up to the top of the queue and say, look at them right now because they've got a bleed and we need to get a neurosurgeon in. So luckily, the goal is to reduce time to diagnosis from over 3 hours to under 15 minutes. And fortunately, we've been able to see that change. We've had dramatic reductions in turnaround time. And this is good for patients because the patients now have a chance of surviving. And those who would have survived now have a chance of reduced brain damage because we're able to get to them much faster. The one thing I want to highlight with this example is we didn't create this algorithm. So in the previous example, we created it, but we didn't create this algorithm. Where did we get the algorithm from? Actually, it was from a hackathon. So I actually am really excited about events like this. We actually reached out to an individual who is based in Japan. He entered a hackathon that was hosted by Stanford and created an algorithm that was able to detect brain bleeds on head CTs. And so we reached out to him and we said, you know, what you've done is some incredible work. It would save us a lot of time if we could use your code. And his response was, you know, I'm not even in healthcare. I work for a tech company in Tokyo, and I kind of do this as fun. It's kind of a hobby. I'd be more than happy for you to use my code. So we took it, we modified it, and that's what's actually running to detect brain bleeds at our hospital to save lives. So I would turn to you, to this crowd, to say artificial intelligence is changing medicine. And it's people like you who could really make a huge difference in working with people like us to really bring your solutions to the hospital to help us save lives and improve the quality of care that we give to our patients. So I'm going to stop there because I believe we're running a little bit over time, and I'm happy to take any questions.
Well, thank you for your presentation. I just found it really, really cool about how you bridged AI in healthcare. And I found the integration of that with like bedside care and even brain hemorrhages really amazing. I'd like to know a little bit more about like the future of your work. Do you think that this early warning AI technology could be applied in the OR per se, in like high risk cases or surgeries? What do you think?
It's a great question. In fact, our team, as we speak, is working on, I think we're calling it SurgitCal with an AI in it in the surgery population. So we have a very bright general surgeon who is actually just finished his training over at Harvard in Boston. He's going to be with us in the summer of this year, who's leading that project. And so our data science team is now working on how do we actually now take this to the operating room and to the surgical population. So that's exactly where we're headed.
That's really cool.
Thank you.
I just got another question, Doctor. How do you think AI can be used in public health settings? Like, because public health isn't so much symptom based, it's more like big data. How do you think AI can be used in that regard?
Yeah, it's a great question. I think so. What I also have done in the past is a lot of population health epidemiology, especially as it relates to drug therapies. And there's a lot that we can do because there's a lot of systems planning and policy planning that people do, but it's often based on this is what I'm hearing or this is kind of what I'm seeing, without really understanding a lot of patterns of what's happening in the environment. So I would say that we would be able to use AI to not only understand where are our pain points for a lot of public health issues right now, but based on our historical patterns of what we see, what can we predict will happen a few years from now, and plan the health system accordingly. Just one example of this is a colleague of mine, his name's Kamran Khan. Dr. Khan he's terrific, epidemiologist, infectious disease specialist, Harvard trained, came here, heads up a company called Blue Dot. I don't know if you've heard of it, but this whole COVID-19 thing, they were the first group in the world to detect it and publish on it. And they did it using data science. So it's their algorithms when they actually started noticing a whole bunch of symptoms in Wuhan that were surfacing on the web using natural language processing and machine learning techniques that they said, we think there's an issue here. And they're the ones who actually raised the alarm publicly. It was using AI.
Wow, that's incredible.
Mm-hmm. It's neat.
Thank you.
Thank you. There's lots of potential. And again, I'm very excited about groups like this getting together and having hackathons and talking about topics like this because you know, I'm humbled by the incredible talent that we have. And I don't think, I didn't say this jokingly. I really do think that a lot of these discoveries that people have, people your age, not much older than you, they're going to come up with these crazy, incredibly applicable solutions that we'd love to have in healthcare. So I'd love to be able to leverage all that talent.
That's absolutely amazing. Again, thank you, Dr. Mamdani, for your insightful presentation. Does anyone else have any questions? Nothing in the chat. Okay, well, thank you again. It was a pleasure. And finally, we are going to Dr. Mandich.
right, I'm just gonna hide. Oh, I need you to let me share my screen, please.
Yeah, I will do that.
Thank you.
Okay.
Okay, there we go. Perfect. So let me just pop this up. So my talk's a little bit different than the other two. We've had some amazing speakers today. And when I was trying to prepare what it was I wanted to say today, I definitely wanted to tie in technology, but also I'm a happiness researcher. And so when I built my plan for what I want to share with you today, I kind of have a hybrid model in my head of I wanted to capture some of the most interesting things or surprising things that I've learned as a happiness researcher. And then we're going to talk about how it all ties into technology as well. So with that, we'll get started. I introduced myself at the beginning, but if we haven't met, I'm Gillian and I'm a happiness researcher. So I study the science of happiness, which we're going to talk about today. I'm also on a lot of different media where I talk about the science of happiness. I've done 2 TEDx talks. And basically, what I am most passionate about is figuring out how do we live our best life ever. My PhD is actually in health science from Western, and then health promotion is my area of focus. So I look at happiness as a tool to improve health. And I'll touch on why that's so important in a minute. But just to give you a quick overview of what we're going to cover in the half an hour here today together is I'm going to sort of give you a broad overview of the science of happiness. There's 3 myths in particular about happiness that I think are really key to helping shape the fundamental understanding of what it means to be happy and how to be happy. So we'll cover those. And then we're going to dive into the technology and how that is connected with happiness. And what I will leave you with at the end of our session is 5 different tools and strategies that you can use in your life to be happier. So no matter how happy or unhappy you are right now, by the end of our time here together, you will have some evidence-based tools that you can use, that you can share with your friends, your family, in order to increase your happiness, because it is possible. So one of the things, you know, as soon as I tell somebody I'm a happiness researcher, the immediate first question for most people is like, okay, what's like the one thing, right? What's the one thing I need to do or buy or get or say in order to be happy? And I guess the good news and the bad news is there's no secret. There is no magic pill for happiness. There is none of those things. And yet there is a science to it. And we can take research and the best available knowledge and apply it in order to help us most effectively or potently impact our happiness. So like I told you, I come at studying happiness from the perspective of health promotion. And what's really interesting is when you compare happy people to unhappy people, happy people have lower rates of cardiovascular disease, they have stronger immune systems, they heal faster from injury, they live longer, they tend to sleep better and make better nutritional choices. So when we think about what can I do to impact my health, knowing that happiness is one of these things where it actually has pretty far-reaching applications in several areas of our physical body. But not only that, even in the workplace or school settings, happy people, again, when we compare them to unhappy people, they are better problem solvers, they're more cooperative, they're better team players, they're more creative. They also, in terms of how we show up in the world, they have longer and more fulfilling marriages, they're more altruistic. So they're more likely to volunteer both their time and or their money. So when we think about one thing having such a significant impact on so many facets of our life, happiness is really a key piece of this equation, right? And so the way I think about happiness is, you know, like when I started my talk today, I didn't have to define for any of you what happiness is. And yet we all have a different understanding. Or if I was to ask every single one of us on this call right now, how do you define happiness? It would be different. And so, while it's universal and that we all have a general understanding, what I think is really interesting about happiness is there were certain things, especially when I first came to studying happiness, where I was surprised to learn things or myths or misconceptions or altered perceptions of happiness. And so I wanted to just touch on 3 of them right now, just so we can kind of get a general understanding and we're all on the same page. So the first thing is, how often do we say, you know, I will be happy when, fill in the blank, right? When I finish my degree, when I live here, when I have X amount of dollars in my bank account, when I am a size, whatever. We all have these stories that we create in our mind about happiness. And we think that one day we will achieve it. When in actuality, happiness is not an endpoint, right? We don't just like arrive at happiness ever. That's not a thing. It's a practice. It's a means to a life well lived. And so you might be like thinking, okay, Gillian, what do you mean by that? Well, essentially, this is how I think about happiness. I don't know if any of you here follow The Rock on Instagram. I do. And before COVID, The Rock would go around and he'd be on it, posting pictures on all his movie sets. And he had this like 30,000-pound gym. We carry all his equipment and he'd set it up with things and he'd have these really intense workouts because The Rock knows if he needs to be fit and strong for his movies, he has to exercise on an ongoing basis, right? So The Rock would never walk into the gym, have the best workout and leave and say, I've reached fitness, I'm good, I don't have to exercise anymore, right? It sounds silly. And we know that if we want to stay fit and strong, we have to continually exercise. And so the same thing applies to happiness, right? We don't just arrive at happiness one day. We have to work on it. Just like if we want to be fit and strong, we need to exercise. If we want to be happy, we have to do things on an ongoing basis that make us happy. Or another example would be, say I made this green smoothie for you that you can see on the screen, and I put like all the superfoods in it. And I handed it to you and you drank it. You would never say to me, thank you, Gillian, I've reached nutritional wellness. I'm good. I don't have to, eat again, right? That's so silly to even say out loud. And so if we can take the same lens that we look at nutrition, that we look at fitness and apply it to happiness, it really does change the way we understand happiness because we recognize that it's not a destination. We don't just arrive at it one day. It's something that we have to work on a continual basis. So the second myth, and this is something as a happiness researcher, when I first started studying happiness, so I actually studied childhood obesity before I studied happiness. My master's degree is actually in child and youth health. And when I started studying happiness, part of the reason from a personal perspective was I wanted to figure out how to be happy. I thought the goal in life was to figure out how can I be happy all the time? I don't want to feel anxious. I don't want to feel stressed. I don't want to feel like depressive symptoms. I don't want those things. I want to figure out how do I get rid of those things and just be happy all the time? And so I thought, well, Gillian, if you're a researcher, then why don't you apply these skills to your life to figure it out? And one of the things that I quickly learned was that the goal is not happiness all the time. Especially when we think about healthy psychological functioning, we actually need a spectrum of emotions, right? If we don't have lows, we can't appreciate the highs. And really, when we think about the palette of the human experience, we really do need to experience all of these different emotions. And oftentimes, one of the things I think I'll hear people say, label emotions as bad or good, when that's not the case. Emotions or feelings, right? Stress, anxiety, they're not necessarily bad or good. Some are easier than others, some are more challenging. They're very different. And so the question isn't how do I get rid of those challenging emotions? We don't want to marinate in them for an extended period of time. And that's often when we can reach out to friends or health professionals if we're feeling like that. But at the same time, if you think about even in your life, when are those times where you've gone through something very difficult? Maybe it's a breakup, or you have moved out on your own, or you're going through a really difficult class. Oftentimes, situations where we are challenged are opportunities for us to show our strength, to test our resilience, to test our capabilities, and really show us what we are capable of. So I want to just give you permission right now to know that you do not need to be happy all the time. The goal in life is not to be happy all the time. I, as a happiness researcher, am not happy all the time, nor do I wish to be, nor do I wish for you to be, because we really need that entire spectrum at the same time. When we embrace that spectrum of emotions, we can start to prioritize positivity. And I'll get into some of those tools and strategies in a minute. Now, the third myth is I know what makes me happy. So right now, for you, and when you're watching right now, if I say to you, what makes you happy? Something will come to your mind, right? And so I'm actually going to illustrate this myth with an example. So I have two questions for you. And you are welcome to share your answer in the chat box. You can think about it in your head. You can write it down, whatever you want. But I have two questions for you, okay? So the first one is, right now, on a scale of 1 to 10, how happy are you? So no judgment, just check in, see how you feel, and just know, like, 1 being, I'm not happy at all, I'm very unhappy, to 10 being, I'm extremely unhappy. How happy do you think you, or how happy are you right now? The only person that knows that answer is you. So if you want, feel free to share the answer in the chat box. You absolutely do not have to, but just take a moment and check in for that. Okay, so you have an answer? Probably a 5, a solid 7.5. Awesome. So my next question is a little bit harder, and it's a multiple choice. So you got a 1 in 4 chance of getting it right. So say today you won $10,000 in the lottery, right? And I said, I want you to take that 10K and spend it in a way that would maximize your happiness. And you have 4 choices. Would you either A, go out and buy a new wardrobe, B, spend it on a trip to Jamaica or wherever you want to go, of course, when it's safe to travel again. C, if you budgeted $200 a week for a year for self-care. So whether that be things like buying yourself flowers, going for a massage, ordering in or taking out dinner, or D, you donated all of the money to charity. What do you think out of those 4 options, if you were to spend that 10K, would maximize your happiness? Does anyone have any guesses? What do you think? Any brave souls that want to venture a guess? A D, yeah, okay, good guess. C, B, C, investing too, yeah, good shot. So maybe C, depends. You guys are very smart. The answer is C. And so you may be wondering, okay, well, why is that, Gillian? And why are you asking me these 2 questions when we're talking about if we know what makes us happy? And so the reason I chose to ask you these 2 questions is to illustrate a point. So it turns out we're pretty good at assessing how happy we are. So when I asked you on the scale of 1 to 10, how happy are you? If I was to take one of the validated tools that I use in my research and administer that questionnaire and figure it out, chances are that the answer that I got and the answer that you came up with would be pretty close. So we're pretty good at figuring out how happy we are. But what we're not as good at as humans is figuring out what it is that makes us happy. We often think it's the bright, shiny moments or the days that we graduate or these moments, birthday parties, that are the things that make us happy, when in actuality, that is not the case. So when we look in terms of happiness, it's actually these sort of small bursts of happy moments that cumulatively add up to a happier life. So it's receiving a nice email in the morning, and then spending time on FaceTime with your friend over lunch, and then going for a walk with your dog in the afternoon. These seemingly small, and I'm using air quotes on the word small because they're small in terms of time or effort oftentimes, and yet in terms of impact, they really are not small, because what they do is they create what we call transient bursts of positive emotion, these upward spirals, these little boosts. So this would be, for example, you get a text message from a friend and it brightens your day, right? It puts a little more pep in your step. You feel a little bit happier. And so these moments where we can start to turn up the happiness actually add up to more happiness than those big shiny moments. So especially I think in the past year where we haven't been able to have some of those more, holidays together or birthday parties together or celebrations, knowing that what can I do throughout my day? How can I look throughout my day and create those small bursts of happiness, those moments of joy, because those will actually help to create those positive spirals in your life. So with that being said, now that we kind of all have a general understanding of happiness, we know that it's not a destination, it's something that we have to practice ongoing. How does technology fit into all of this, right? I hate this picture because this is such an accurate representation of our world right now, right? It's actually kind of cut off there, but there's a garbage can on fire and everybody's just taking a picture. Nobody's putting it out, right? Everybody's posting it on their Instagram and they are not necessarily dealing with it. So technology is kind of this double-edged sword. The way I think about it is like this. It's a tool. It's a means to an end. It helps us to accomplish things in our life. And at the same time, we have a lot of power and say in that if we can be intentional about using our technology. So I did all my schooling at Western and I taught in the Faculty of Health Science for 4 years while I was at Western. And one of the courses I taught was actually a new course that I designed called Health and Social Media. So this was a course for 4th year health science students. And essentially it was to sort of look at social media from 2 perspectives. So the first perspective was, as a student who is going to a professional program, so whether that be medical school or physiotherapy or occupational therapy or speech language, whatever it is, how do you as a health professional navigate social media and create your own profile? And at the same time, the other part of the course was really about how do we leverage technology to share credible health information? How do you weed through the noise, right? Because we can all agree it's very noisy, to tease out the key pieces, the trustworthy pieces of the equation. And so one of the slides, this is one of the slides I actually used in my first lecture. And this is actually a line from Spider-Man, which I think is originally a Voltaire quote. In the movie, he says, "With great power comes great responsibility." And this is how I see technology. It really, we have this opportunity to really do amazing things. You know, in the last talk, we learned about how AI can save lives. And so there is so much good there. At the same time, I think we can all see the other side of it from our personal perspective sometimes when it can go the other way. So how do we navigate this? How do we leverage technology, social media in order to use it to help improve our life, to boost our happiness as opposed to hindering it? So this is kind of like how I see it in a picture. So this is a picture of a parking, like where you go to pay in the parking meter, in an underground parking meter. And you'll notice that there's a solar panel on the top, right? And so these are both two great examples of technology. The parking meter means there doesn't have to be an attendant there taking money, right? You just put in your car and get your thing. So that's great. Good use of technology. Solar panels are amazing. We can use and harness the energy from the sun to create energy for us. So these are both really great things. And yet they've put them together. And what is wrong with this picture? Does anyone have any idea? What is the problem with what is going on here? Any guesses? Okay, I'll tell you. The solar panel is in a parking garage, so there is no access to sun. So sometimes we can actually take technology and use it in a way where we're missing the mark. And so how do we tee things up to really use technology in a way that's going to leverage and maximize our happiness? And so that's what I'm going to spend our last bit of time together today, is really talking about some tools and strategies. What are things that we can actually do to boost our happiness, especially with that lens of technology? So the first one is controlling what you can. And I don't know about you, but sometimes you ever feel like overwhelmed. You go on social media and you just get off and it's just too much, or you can't keep up with the notifications, or you feel like you're constantly having FOMO, whatever it is, right? Like, there is a lot going on in our lives that we can't control. And there are certain things that we can control. So in research, we call this term autonomy. So autonomy is essentially the recognition that our life, what we're doing, is self-chosen. So I am choosing and having control over certain parts of my life. That's not to say that we can control everything, because let's be honest, especially this past year, right? We have definitely gone through times where we are not having things that we can control, right? Even things like where we're going, who we're seeing, where we're working, where we're going to school. All of these things are completely changed. And at the same time, there are still certain areas of our life where we do have control. And it's really important that we choose to give more of our focus and our attention there. So what I'm talking about is not trying to control things that we can't. It's asking a different question. It's asking, where in my life do I have areas of control? And let's give more of my attention and my focus there. So that's what I mean by autonomy, and actually is a really important piece of the happiness equation. So much so that autonomy is more of a contributor to your happiness than how much money you have, how attractive you are, how good your sex life is, or how popular you are. So I think we can agree that all four of those things contribute to our happiness, and reminding ourselves that autonomy, so this idea of focusing on the areas where we do have control and giving more attention there, has more of an impact than any of those things. Pretty cool, right? So then the question becomes, okay, well, what can you control today? Where are those areas that you can control? You know, are you washing your hands? Are you moving your body? Are you getting outside? Are you getting good sleep? Are you, whatever these things are, asking ourselves, where do I have control, and putting more of our attention there. And one of the areas that we do have a lot of control is how much media we consume, right? We do not turn on the TV most of the time and see news like this. This is like, it's so cute. It says breaking news. Local stingray in great mood. The water is nice and warm and his flappy parts feel very flappy indeed. So we don't tend to see this lovely, happy, positive messaging when we turn on the news most of the time, right? It's a lot of doom and gloom. It's a lot of fear-provoking things. It's a lot of these things. And so one of the areas that we do have control is how much media are we consuming? And it really does matter. What we watch matters. What we're listening to matters, even if it's in the background. You know, sometimes we'll turn on the TV in the morning and put the news on in the background where we're getting ready or something. Even though it's in the background, it still is important and influencing your mood and your happiness. Some work by Sean Aker and Michelle Gillian, they found that people that watch 3 minutes of news that they perceive to be negative in the morning had a 27% greater likelihood of reporting their day as unhappy 6 to 8 hours later. So this is not just a matter of turn the TV on, watch it, turn it off, move on. The residue of what you saw moves with you throughout your day. So when we think about things that we can control, I'm not saying to put on blinders and not watch the news. Absolutely not. What I am saying is, though, is we need to check in and not have it go on any longer than that. Check in, stay informed, but recognize that it really does impact even after we turn off the news, right? So the second one, I don't know how many of you guys can relate to this, right? It says work, but it could be school. You're all day, we're working, we're doing our homework, whatever. Our brain often starts to wander to the sleep we didn't get the night before, to what we're going to do later tonight, to the newest show we're going to watch on Netflix, whatever it is. And then we finally, at the end of the day, get into bed. And then what happens? Oftentimes, right, our mind starts to race to our to-do list for tomorrow, to what we need to study tomorrow, to our homework that we need to do, to groceries we need to buy, whatever it is. So our mind is a very powerful tool, and our newsfeed is a very powerful tool in shaping our experience of our life. And it really does matter. So I'm going to show you what I mean with an example. On the screen right now, you'll notice there's a bunch of different words in a bunch of different colors, right? And what I'm going to ask you to do in a minute, and you can either do this out loud or in your head, it doesn't matter. I'm going to invite you to say the color, don't read the word. Okay, so say the color that you see, don't read the word. So for example, the first line would go blue, green, purple. Okay, so I'll give you a second to try the other 3 lines. Say the color, don't read the word. How'd that go? Any brave people want to put in the chat box how that was for you? Was it easy? Was it hard? Right? It is. Did it, but it was hard. Yes. Confusing. Absolutely. And why is that? Why was it confusing to do? It's because our brain is so used to seeing letters arranged in words that we read, right? So our brain wants to go yellow, blue, orange, green, blue. It wants to read because when we see letters assembled, our brain does what it always does in this situation, which is read words. So if we want our brain to do something different, we have to actually put in effort in order to make it start to do something different, right? It's like when you want to change a habit, you want to start a new habit. It requires a lot of effort and attention, especially at the beginning. The good news is over time, when we start to build a habit, it gets easier. And at the beginning, it can be very difficult. And this is what happens with our brain and our mind. If our mind is wandering all the time, if we're stressing out about things, we actually have to interrupt that pattern and focus on something different in order to think something different, right? And the reason, part of the problem in this equation is what we call the negativity bias. So an example of the negativity bias would be if, for example, today you received 10 compliments. So 10 people said 10 really nice, wonderful things about you. And one person said one bad thing. At the end of the night tonight, when you go to bed and you put your head on the pillow, what is the one thing that's in your mind, right? It's that one thing. It's that one bad thing that somebody said. And this is an example of the brain's tendency, even amongst all of these good things, to focus on the negative things. So if we want to start to notice positive things, if we want to start to notice good things, we actually have to train our brain to look for those things. So it's like with those words, right? If you want to do something different, you actually have to give focus and attention to something in order to make that happen. The good news is it gets easier over time, and we can actually rewrite this negativity bias. Now, this does not get easier. Have you guys heard of this term doom scrolling, right? This is where, and I think we've all experienced doom scrolling in some capacity or another. You grab your phone, you start scrolling Facebook newsfeed, Instagram newsfeed, you start reading Twitter, whatever it is, and you start to get fear and panic and scared, because a lot of what we are consuming is very fear-provoking. It's anxiety-provoking. And so one of the things that we can do in terms of things that we can control and what our mind is seeing is really paying attention to this behavior. Are we doing this? And if we are, we have to interrupt that pattern and stop. The other really big culprit of this on social media is this idea of the comparison trap, right? Where we look at our social media, or pardon me, someone else's social media, and we compare it to our life. And we just look at their highlight reel, their perfectly curated, filtered, photoshopped, Canva'd, whatever, what they're choosing to share, and we compare our life, our entire life, the front story, the back story, the side story, the difficult times, and we start to compare. So these are two things that really do influence how we feel. And when we think about how do we control our mind, these are really good examples of when we have the awareness that we are doom scrolling, when we have the awareness that we are actually comparing ourselves to somebody else, we need to interrupt that pattern. We need to stop that pattern because it has major implications in terms of our mental health and our happiness. So what does this mean? Well, this is like we need to check in. Instead of just consuming technology, or like we're sitting on the couch or you're waiting for an elevator and all of a sudden what do? It's almost like a habit, right? You grab your phone and you start scrolling. And so we need to be intentional consumers of media using our technology in a way to help us charge our battery. So if we go on social media and we're feeling good, and we get off and we're not feeling as good, then this is an indication that something needs to change. And if we are feeling good, then that's an indication that, wow, okay, maybe I'm following positive accounts that are inspiring me, things that are making me happy. I am not doom scrolling. I am not comparing, right? So the third tool and strategy I wanted to give you was a delete, because I think sometimes, especially when we all have very busy schedules, it can be almost overwhelming to try to add more to the plate. Gillian's telling me that I need to, focus on the things that I can control and whatever. These items start to add up. And the good news is sometimes we can actually remove or delete things to increase our happiness. So, sometimes it really is a matter of stepping back, of doing less, of spending less time with certain people. And this is not to say that if you don't, like, for example, doing laundry, you can just quit laundry. There are certain things we have to do as functioning humans in this world, absolutely. And I would be willing to bet if you did an inventory of your life right now, there are certain things that you do that you don't like, that you can eliminate, people that you can spend, maybe if you can't get rid of them altogether, maybe their family, you can spend less time. And if you can't spend less time, you can spend less cognitive time thinking about those things, because sometimes doing less, removing things can actually have a positive implication in terms of your happiness. So my fourth tip is all about connection. And today is a very great example of that, where we're all safe in our homes, and yet we're still able to connect. If this would have been a year ago, we probably would have been all together having this event. And yet we can still connect even though we aren't together, because it's so important. Research from Harvard found that the #1 predictor of both our long-term health and our happiness is social connection. So above our gender, our race, how much money we have, our education level, of all of those things, the #1 predictor is connection. And especially in today's day and age where we are not allowed to physically be close, we can still feel close by creating that connection online, by using technology, by getting creative to create that feeling of connection. So then my question for you is, who's one person you can reach out to today? When we're done this event today, who's that first person that popped into your mind? That person. And I want to invite you, whether it's tonight, tomorrow morning, but sometime in the next day, let's say, reach out to that person. Because when you reach out to somebody to check in, say, hey, how are you doing? They get a boost in their happiness because somebody cared. Somebody asked them, how are you doing? And you also get a boost in your happiness because you did something nice for somebody else. So I want to invite you when you're done this call tonight at some point or tomorrow morning, whoever that person was that just popped in your mind, first top of mind person, trust that that reaching out to them is going to give you both a burst of happiness. Now, my last tip is, I think we've been talking a lot, today about technology and AI and all these things, that sometimes we actually have to unplug. We have to get off our screens. We need to put our phones away and be a human in the world, right? So whether that be jigsaw puzzles, I thought this was a cute picture of a jigsaw puzzle I saw on Instagram, or whether it's coloring, whether it's doing arts and crafts, whether it's reading a book, sometimes we need to give ourselves a break. We need to unplug. We need to take that time to step away. We're spending so much time on screens, more time than we've ever spent for most of us. So we have to create an environment where we're not on screens, especially if you're, say, in school and you're doing homework and work all day long. And then at night, what do we often do, right? We want to go put on like the latest season of something on Netflix. Looking for areas of opportunity in your life to get off screens, to help support. The blue light from screens can be very detrimental in terms of our circadian rhythm, our sleep-wake cycle, right? So just ask yourself, what can I do that's a screen-free activity? And try to bring more of that into your life whenever possible. So with that, I just wanted to do a quick recap. There's all 5 of the tools and strategies for you right there. But I wanted to just leave you with one thought. And this is a thought that I heard on a podcast. It was a couple of years ago. It was on Tim Ferriss's podcast, and he was interviewing Derek Sivers. And Derek said, if more information was the answer, we'd all be billionaires with perfect abs, right? Because knowledge is not enough, right? Like you always see it here, you see like this meme on Instagram, right? Like knowledge is power, knowledge is power. But in actuality, knowledge is potential power. It's what we do with what we know that really does matter. And so, I shared with you all these different tools and strategies today, and my intention is for you to use them in your life to help you be happier, because as a byproduct, everything else in your life, your schoolwork, your friends, your family will come, and it's still up to you. Like I said at the beginning, there's no magic pill for happiness, right? It's up to each and every one of us to do things. And by using some of the tools that we talked about today, you're more likely to move the needle forward in a significant way. So with that, there's all my info. If any of you have any questions about this, about my research, I didn't even touch on any of the research I do at Sick Kids, but it's all related to happiness and mental health. Please feel free to reach out anytime. So with that, I'll stop sharing my screen here, and we'll have any questions.
Well, first of all, thank you, Dr. Mandich, for that very insightful presentation. I really liked your point about how it's not about acquiring the knowledge itself, but what you do with it, and how happiness itself is relative, and it really depends on the person themselves. I'd like to ask, because a lot of if not everyone in this call right now are students in undergrad or in high school. During this time with COVID, what are some of your tips to stay happy and manage the stress, per se, of studying and schooling at home?
Mm-hmm. Yeah, this is real, right? And one of the things that I actually just did a guest lecture at U of T, and I was talking to the students after. I had a very similar question. And so some of the things that I was saying was, like I was saying, like knowledge is potential power, right? We all know certain things that we should be doing, right? We need to move our body every single day. We need to get good sleep. We need to try to eat healthy food most of the time. So I know these are obvious things, and yet I think it's really good to have the reminder. And exercise in particular is one of the most effective instant mood boosters. So I think, especially when we're at our computer all the time, looking for areas where we can move our body throughout the day, right? Because it's so easy to get on, especially if you've got class and you've got lecture, and then you can sit and be on your computer for the entire day very easily. So what we have to do is create an environment that's conducive to allowing us to have a little bit of movement. And when we look in terms of the effects, it's cumulative throughout the day. And even like 10 minutes of movement can have mood boosting effects for up to 12 hours. So whether that be like, I have a standing desk. I'm sitting right now because I'm talking to you guys, because I'm a hand talker already. So I'm standing, it'd be too much for you guys. But I'll move my standing desk, and I'll try to stand sometimes. I have over in my corner, I have a kettlebell. And so sometimes I'll get up and I'll just do kettlebell swings or band pull aparts or go out for a walk. So I think doing things that we can do to move our body throughout the day, while it may not feel productive, or it may feel like it's taking time away from doing our homework, in the big scheme of things, it's actually increasing our productivity to do things like that. The other one is like there's a lot of things we can do. The other kind of big one, I think, especially when we are studying, is sleep. And I think that it can be so easy for us to, especially at the end of the night, and just be put on a show and you get into it at Netflix, and then the next thing you know, it's midnight and you got to get up at 6 or 7, right? So I know it's very cliche to say, but I really do feel like it's an important thing for us all to remember, is how restorative sleep is, how it really does tee us up. We all know what it's like to wake up refreshed after a good night's sleep, and our energy is better, we're sharper, things are better, we're nicer. And we know what it's like to be on the opposite, where we haven't had a good sleep. So practicing good sleep hygiene, really, really key.
Amazing. I'm definitely going to employ some of those tactics the next time. Well, probably tonight when I'm done studying, so I will do that. Any other questions from our participants? If not, thank you, Dr. Mandich, for that amazing presentation. It was indeed very insightful, so thank you again. I'm going to share my screen right now, and we will do the raffle draw for one Panago Pizza compliment certificate, which will be mailed to anyone on this list. So let's go. Okay. So that was Chabrina. Congratulations. And please email me with your postal code and mailing address, and we will get that to you as your award. So thank you everyone for coming. And again, please stay tuned and follow us on our Instagram page, as we will be posting updates for our upcoming hackathon in July. So thank you. It was a pleasure, and we will see you next time. Thank you. Bye, everyone.